Hi, my name is Gustavo Lopez. My topic is treatment of Fabry disease with the Pharmacologic Chaperone Migalastat. Definition. Fabry disease is a rare, progressive, and devastating X-linked disorder caused by the functional deficiency of lysosomal alpha-galactosidase. The result accumulation of glycosphingolipids, predominantly globotyrosylceramide, GL3, can lead to multi-system disease and early death.
Fabry disease is an inherited genetic condition that is caused by a problem with a gene called the GLA gene, which is passed on through your family. The GLA gene contains DNA that normally produces an essential protein. This protein is missing or doesn't work properly in people with Fabry disease. Let's take a closer look inside the body. Our bodies are made up of billions of cells that work together to keep the body running properly. Inside your cells are unique, tiny structures, each with its own purpose. One type of cell structure, called a lysosome, acts like a small recycling center. Lysosomes use special proteins, called enzymes, to help break down and recycle waste in the cells. Normally, the enzyme alpha-galactosidase A, or alpha-Gal A, breaks down a fatty substance called globotriosylceramide, or GL3. In people with Fabry disease, alpha-Gal A is either missing or doesn't work properly due to a problem with the GLA gene. A mutation, or change, in the DNA results in cells that have no alpha-Gal A at all, have alpha-Gal A that is not functional, or have some alpha-Gal A with reduced function or activity. But in all cases, there is not enough working enzyme to break down GL3, which builds up in the cells of the heart, kidney, skin, nervous system, and blood vessels. This can lead to unbearable burning pain in the hands and feet, dark spots on the skin, trouble sweating and overheating, a distinct eye pattern, or hearing loss. People with Fabry disease may feel healthy or may experience a range of these symptoms. But over time, GL3 buildup may lead to irreversible damage or life-threatening events, such as kidney failure, heart failure, or early stroke. To learn more about Fabry disease, talk to your doctor or contact a Sanofi Genzyme Patient Education Liaison.
Applications in medicine. Binding of the Pharmacologic Chaperone Migalastat to the active site of alpha-galactosidase stabilizes certain mutant enzymes, thus facilitating proper trafficking to lysosomes, where dissociation of migalastat allows alpha-galactosidase to catabolize accumulated substrates.
Fabry is a disease that's caused by a deficiency in one of the enzymes that are responsible for recycling cells in the body. It's carried on the X chromosome, and carrier females have a much milder disease usually than the fully affected males. Males can have a severe picture of neurologic pain, which leads to a feeling of burning, usually in the hands and the feet. Males can also have problems with the kidneys, which fail over time and can lead to the need for dialysis and eventually renal transplant. They also can have a cardiomyopathy that can be severe enough to ultimately require cardiac transplant. In females, the symptoms can be similar, but they're usually milder and later in onset. Fortunately, we have enzyme replacement therapy. For most patients, the enzyme infusions are effective in stopping progression of the disease and in most cases even causing improvement in the symptoms. We also have ready access to the clinical trials that are going on, many of which are happening here at the Center for Rare Disease Therapy. And so we can work with families to help them understand what might be the best option for them.
Pros and cons. Pros. The higher volume of distribution of Migalastat, 66.5 to 130 liters of total body water in adults, than of recombinant alpha-galactosidase hints at the possibility of better diffusion in organs and tissues. Cons. This disease causes pain in the extremities, decrease of absence of sweating, vascular lesions, different types of heart disease, such as ventricular hypertrophy, several affects the kidney, leading to kidney failure.
If you have tested positive for Fabry disease and been to the Royal Free Hospital for assessment, this short video aims to provide information on how the condition can be treated and managed.
Once you've had the organ assessments, if it shows that they're affected anyway, we'll invite you back up to our centre for treatment, which would be enzyme replacement therapy.
Enzyme replacement therapy is given by an intravenous infusion directly into the bloodstream. It works by replacing the enzyme that is deficient in Fabry disease.
So we expect that enzyme replacement therapy will be a long-term therapy for patients who are receiving it. It has beneficial effects and many people feel better from the point of view of their pain and their bowel symptoms, and we see improvement or stability in many people's organ function.
The infusions are given every 2 weeks. You will have the first infusion at the Lysosomal Storage Disorders Unit at the Royal Free Hospital, so you can be observed for a short time afterwards in case of any reactions.
I've been on the enzyme treatment for about 8 months now, I'd say. Yeah, it's okay.
If all goes well, you will have subsequent infusions at home, so you will be able to fit them in around your lifestyle.
I have the enzyme replacement therapy. Every fortnight a nurse comes to my house and infuses me with it.
The infusions I have with my sister Cherry, who lives around the corner from me, so we have it together and chat and a cup of tea, and you know, so it doesn't worry me.
Yes, getting around the infusions is fine because I'm working now, so we kind of work around the work schedule because I'm on days and nights. It varies every week, so roughly 2 weeks, like 15, 16 days, we can do the treatment.
At all times, you will receive help and support from our specialist nurses, and we'll make sure we see you every 6 months to see how you're getting on.
It is nice to have someone come to you as well, to have that little bit of a chat with someone that understands what the Fabry's is as well. So
Living a normal life. So far so good, yeah. I have no complaints.
If you would like more information about Fabry disease, the MPS Society is a UK charity supporting individuals and families affected by MPS and related diseases, such as Fabry. www.mpssociety.org.uk.
Issue applied in Ecuador. The Sanofi Genzyme Ecuador company has reported that in the country there are 7 patients with a confirmed diagnosis of Fabry disease, making it an extremely rare disease in our country.
Heart disease and renal failure are both major causes of premature mortality in patients with Fabry disease. Unfortunately, this challenge is complicated further by the impact of these two morbidities on each other. Cardiac involvement is common in Fabry disease, as lysosomal storage occurs within almost all cardiac tissue, leading to progressive structural and functional changes to the heart in over half of male and a third of female patients. Cardiovascular events are the cause of death in over 50% of patients with Fabry disease. Symptoms include dyspnea, heart failure, angina, chest pain, and arrhythmia. These symptoms can be attributed to the accumulation of GB3, which triggers intracellular signaling pathways that lead to cardiac hypertrophy and fibrosis. Left ventricular hypertrophy is the most important manifestation of Fabry disease cardiomyopathy, as it leads to progressive functional impairment. Structural changes of the myocardium cause reduced myocardial contraction and reduced velocity of myocardial relaxation. Higher hemodynamic stresses in the left side of the heart results in valvular thickening and deformation. Conduction defects and repolarization changes are present predominantly in patients with left ventricular structural abnormalities. Fabry disease also affects the kidneys, as GB3 accumulates in the renal glomerulus, causing progressive deterioration of renal function and ESRD. This in turn impacts on cardiovascular risk. It is often cardiovascular complications that are the cause of death in patients with chronic kidney disease. Once reduced GFR is detected, Fabry patients are likely to already have significant cardiovascular abnormalities. Understanding these complex and interlinked disease manifestations is central to improving outcomes for patients with Fabry disease.
Conclusion. Among all randomly assigned patients with mutant alpha-galactosidase forms that were suitable or not suitable for migalastat therapy, the percentage of patients who had a responsive at 6 months did not differ significantly between the migalastat group and the placebo group.
There are over 7,000 genetic conditions, and although I personally believe that Fabry disease is the most important one for every physician to know, you can't know all of them, and all of them are very important to understand. And that's why education for physicians is so important, so they can understand how to prioritize in their patient population, what to really pay attention to, what they really need to think about, and who needs to be referred out to genetics or someone who really understands how to navigate all of these complicated genetic conditions. There are programs that are working on education, events, and lectures that are given to try to help patients understand, there are educational events, there are lectures, there are CME opportunities that are out there to help physicians navigate Fabry disease and other treatable genetic conditions. We put more stock in knowing about Fabry disease at this point because there is a treatment, and we know if it's identified early, then it's going to hopefully make a significant difference in later medical complications. But when we talk about physicians and we talk about rare diseases, you can't know them all. So I think the most important thing is for them to know some key symptoms, some key features of Fabry disease, and know who to refer them to get the best care. When we talk about a specific complication in Fabry disease, if a patient with Fabry disease is having a stroke, the Fabry part is not as important as it is to getting the patient the care they need for that stroke. When we talk about a patient who has malignant arrhythmia, the most important thing is treating that arrhythmia. The most important thing about understanding the baseline of Fabry disease is understanding the small vessel disease and how that contributes and leads to the complications that you see. And the other important thing is knowing that treatment, hopefully, can stabilize or decrease symptoms over time. So when it comes to physicians, you can't expect them to know everything if they're not specialized, but you can expect a specialist to treat the piece he knows with information from geneticists and other specialists in Fabry disease who can help inform and help them understand the quirks of Fabry disease, how renal failure should be treated with a renal transplant in Fabry disease as well, but also understanding there's cardiac implications for that and stroke implications, understanding the depression that's very common in Fabry disease and how that may affect the downstream effect of a transplant and transplant compliance. So it is important for physicians to understand Fabry disease, but they don't have to be full experts. The important part is knowing where to find your full Fabry disease experts, because that can make the difference in a patient's outcome.
Thanks.